Yes, Push Past Nation, check in, check in. We have another wonderful guest for you this evening. As you know, if this is your first time joining us, I am Simone Matthew. And as you know, here on Push Past 10, we're all about bringing you inspirational guests, bringing you guests that have important information to share with you. So we have a very important topic that we will be discussing this evening that may be impacting your quality of life and you have not been able to put a name to it. So let's put it this way. The name of this young lady's company is, listen carefully, Down There Physical Therapy. I'm going to repeat that. The name of her company is Down There Physical Therapy. So I think we all know what we are talking about this evening. And of course, you know, this is a grown folk conversation, but we're going to keep it at the PG rated version. So if you have any little ones around, you don't have to be overly concerned about what they will be able to hear this evening. So we will keep it at a PG rated version. So get your questions ready. If you have any questions, anything that has ever concerned you in the past, I want you to get your information ready so that you can come on in and you can share with us what your concerns in that particular region. Yes, it's a play on word. In that particular region, if you have any concerns that you would like to share. So again, come on in, check in. Don't forget to tag someone. Don't forget to share the live. Let everyone know that we are here and we are about to have a very important conversation. So of course, don't forget, we have to always remember to thank our sponsor, TDN Radio. So talking about grown folk information, if you're looking for nonstop music during the day and great programming at night, you certainly want to check out TDN Radio. So come on in, let's give everyone a couple of minutes to join us as we share the live, as we let everyone know what we are here to do. And while we are doing so, while we're waiting for everyone to join us, I want to just go ahead and share the link to our guest. Her name is Nadia Mills. I want to make sure she has the link as well. So I'm emailing it to her so she can share it on her end. So how are you doing? Check in. Let us know where you are joining us from. Let us know how your week has been so far. Yes, like you, I'm looking forward to the weekend and I hope you have wonderful plans for the weekend. So check in. Let us know that you're here. Let us know that you are ready for the program. And you know, we take you around the world to find our inspirational guests. So we have Miss Nadia Mills. She is in Pennsylvania, but she's originally from St. Kitts. If you were with us last evening for Roots Connection, my new radio program on Q95, you know we were in Dominica. And then last Saturday, we were in Antigua. So we're just all over the place trying to get you the best inspirational guests and the best conversations on Facebook. That's my goal, to have the best conversations on Facebook ever. So check in, join us, let us know that you are with us. And don't forget, we're also celebrating summer. So you can expect a lot of music and, you know, we're going to have someone stop by and do some cooking with us. So if you have not already done so, we want to make sure that you follow and like Push Past 10 so you don't forget and you don't miss out on anything. And while we're at it, we'll just take a couple more seconds to let everyone come in and join us. I just want to thank everyone who is in the background, and they're sending me information on inspirational guests to bring on the program. They're sending me a message of encouragement to keep doing the program, keep going on with the program. So I want to thank the silent supporters for their support of this program. So let's bring on our guest. Her name is Miss Nadia Mills, and she will go ahead and introduce herself and tell us who she is and what she does. So Nadia, welcome to the program.
Thank you, Simone. That was such a wonderful introduction, and I'm sure you've piqued the interest of your audience.
Yes, yes. So tell us who you are, where you're from, growing up in St. Kitts. Tell us about you.
Okay, well, my name is Nadia Mills. I'm from St. Kitts originally, the Federation of St. Kitts and Nevis. I'm not forgetting my divisions. And I grew up on the island, and I left at the time when I needed to go to college. So as you, I went through the Midwestern State program that was supporting scholars from the Caribbean at the time. So I studied, I'm sorry?
Go ahead, we're listening.
Oh, okay. I studied biology and psychology as an undergrad, and it was my intention to go to medical school. But life has its way of changing course sometimes. And so I shifted over into doing physical therapy. And actually, physical therapy was much more in line with what I thought healthcare should be. And so I became a physical therapist. And later into my career now, I specialize in two areas. One is called lymphedema, and the other one is pelvic floor health, which is what we're going to discuss today.
Yes, absolutely. So what was it like growing up in St. Kitts? I grew up, what, you were number 5 out of 5 girls?
No, actually, I was the odd one. I had a
Okay.
brother, sister.
Ah, okay. So what was that like for you?
Well, I was the baby, and quite honestly, I had the village experience because I am somewhat younger than my siblings, and so they were old enough to take care of me growing up. So my eldest sister Laverne was always like a second mother to me. My eldest brother Brian was like a second father to me, and then my other brother and sister Glenoy and Jason. You know, they were all just, I was the baby. They just took care of the baby. You know, so
Oh, absolutely. Yes, so kind of just tell us about your journey into physical therapy, because I know that was not your initial field of study. So tell us about your journey into becoming a physical therapist, and you've been a physical therapist for the last 15 years, if I'm correct?
Yes, 15 years, yeah. Well, like I said, when I left originally, the intention was to study medicine because I can say back in my day, when you like science, you know, like the options were you're going to be a lawyer, you're going to be a business person, or you're going to be a doctor. And so when I left home, I had a very significant interest in science and bodily function, I should say. And so I went into my undergrad as a pre-med, but I kind of looked at the process of medicine, the way it's practiced in general, and that didn't feel like me. I've always been a person that believed that through good habits and through working with your body, you're able to heal yourself or to maintain your health. And so the medical model didn't fit with what I felt health or wellness, which is what everybody calls it now. It didn't fit my wellness model. And so fortunately, I had a really good advisor who said, why don't you look into physical therapy? And quite honestly, I didn't even know what that was at the time. Yeah, because like I said, we didn't have any physical therapists in St. Kitts.
Right.
And so I was able to go and observe a physical therapist. And I said, yes, this is what I think of when I think of health and wellness. And so once I finished my undergrad, I was luckily accepted into physical therapy at Texas Women's University because it is a very challenging program to get into, but I was accepted. And so I studied physical therapy, and I've been practicing in a lot of different settings over time because I was, you know, I'm a generalist, you know, jack of all trades. I like to do a little bit of everything. And so I did several different settings, but I always came back to what we call manual therapy, the hands-on approach to things. So I like manipulating the body, correcting posture, correcting alignment, that always felt like my thing. And so I've been going down the road of manual therapy. And then a couple of years ago, I had a baby unexpectedly. At age 40, I became pregnant unexpectedly because I had pretty much given up on the possibility that I would be able to have a child. And so I became pregnant at 40, had my baby. And unfortunately, I ran into some issues with giving birth because I was the naturalist. I'm like, I'm going to have this baby. I'm not going to
Okay.
get a epidural. I'm just going to, women have been doing this for
We,
thousands
we,
of
we
years.
all think about that initially. I promise you, I did too.
So that was my goal. I was like, I was going to have a natural birth, no pain medicine or anything. And I did manage that, but there were some complications along the way. And in the end, I ended up having what we're going to discuss today, one form of pelvic floor dysfunction. So there was some birth injuries that happened at the time that I gave birth. And so I ended up with some pelvic floor dysfunction afterwards. And even though I was familiar, because as a physical therapist, you have some idea about pelvic floor function. Even though I was familiar with it, it isn't until I had to go through it myself that I realized the depth of the field. And from there, I went on to specialize in pelvic floor health myself. And I have really found that to be my niche. That is my passion now. And so that's why I'm here with you today.
Yes. Now, I know before we even get into the pelvic floor health, which is so important, I also know that you are interested in another area as well. So I want to leave no stone unturned when we're speaking to our experts and we're speaking to people who can potentially help those in our audience with a particular issue. So you also specialize in lymphedema. So tell us a little bit about what that is and what you do in that area.
Okay, so the two specialties that I have come into are somewhat obscure, but very, very present in everyday life, and people just don't really know what it is. So most people know lymphedema from breast cancer interventions. So what lymphedema is, it's a swelling that happens usually after breast cancer surgery when they remove lymph nodes from the axilla, the armpit of the person who's had the surgery. And that interferes with your body's ability to reabsorb what's called lymph fluid. And so over time, the person develops progressive swelling, usually in the arm. But sometimes it could be also in the chest, on the breast, into the abdomen. And a lot of times doctors will prescribe, well, doctors that know lymphedema wouldn't do this, but a lot of times doctors prescribe diuretics for swelling. And diuretics do not get rid of lymphatic swelling. So there's a specific technique or protocol that we use to help to get rid of lymphedema swelling. The other thing to that is breast cancer surgery, breast cancer interventions are not the only way that people end up with lymphedema. When I was a child, I could remember seeing people that had a swollen leg, one regular leg. And my mom works at the hospital. And so I was always kind of around and wondering, okay, what's going on? Why are these people having one side swollen and one side's not swollen? And a lot of times these people had wounds also. So that is also lymphedema. So a lot of people can get lower extremity lymphedema. It could be due to poor circulation. It could also be due to some sort of injury that damages the lymphatic system. So these are the two things that I have really gotten a passion about, because one, I saw it growing up and people didn't know what it was. And also people don't know that there are things that can help. And so that's the big thing. I'm trying to get the word out there that there is help for these things.
Yes. And I'm so happy that you reached out to me to say, let's have this conversation, because you said the word pelvic floor and I was like, huh? What floor? You mean the floor in my house? What part of my house is the pelvic floor? So I'm so happy that you reached out to me. But before we even talk about what we're really here to talk about, I want to acknowledge everyone who's joining us via Facebook Live. So we have Eileen Skinner Corzon. She is amazing. She's speaking about you, Nadia.
That's my best
She is amazing. Oh my, the comments are coming in so quickly, Nadia. I just missed it. She's amazing. Best clinician I have ever worked with. Julie Polidor is on the live. Hi,
friend.
always pleased to listen to you. Learning session. It's going to be a learning session indeed. And Eileen says she's from Sunset, Texas, USA. And let's see, Ariane says pelvic floor, a chi chakra, a woman's powerhouse. I think that is a wonderful way to put it. So thank you, Ariane Perriman. Sabria Senhouse, my sister-in-law is here. I just call her my sister. She was about to tag Ariane, but she showed up. I'm going to mispronounce this name, so my apologies. Quickie, thank you for being here. Now, yes, knowledge is power. Thank you for being here. Eileen, you are such a great teacher. Very good presentation. Terrell, I think he tagged someone, and Judith Ray is here as well. So thank you, everyone who are joining us via Facebook Live. Tanya says Nadia is a phenomenal therapist. She is great. So lots of support coming in for you already, Nadia. So thank you, everyone who's joining us on the Facebook Live this evening. So what is our pelvic floor, Nadia? Take it away.
Well, I'm glad you asked. So, well, I'm gonna give you the big picture, and hopefully it will help you to understand the importance of it. So the pelvic floor is part of your core, right? Everybody knows this word core. You know, everybody does their sit-ups and they crunches and stuff because they're working on the core. And so unfortunately, we mistakenly think that the core is just the front of our abdomen. So, you know, we're working on the abdominal muscles. The core actually is the entire mass of muscles that pretty much start from the bottom of your rib cage down to your pelvis. And it has sides. I like to think of it like a box. Okay. So the top of the box is the diaphragm. That's your breathing muscle. The back of the box are your back muscles. The side are your oblique abdominal muscles. The front is your rectus abdominis. That's the one, the six-pack that everybody tries to get. And there's also another muscle that kind of encompasses the whole thing called the transverse abdominis. Don't worry about the names, you know, don't get caught up in that. But just understand that these are the parts of what makes up your core. The bottom of your box, that's your pelvic floor. Okay. So until something happens to it, we don't even know that it's there or really what it does. But it is a group of muscles that help with a couple of things. In terms of the core, it helps to support. So from the bottom, the box, it's supporting everything that's on top of it. So on top of it, you have your intestines, you have your bladder, you have your sexual organs, you have your rectum, your anus. So your pelvic floor is that bottom that holds everything up and inside. The other thing is it helps with supporting your hips. So that's why it's like the pelvis is just such an amazing thing. Most of your muscles in your body attach to the pelvis in some way. Okay. The only muscle groups that don't attach to the pelvis directly are below your knee. So anything above your knee up to your head has a connection to the pelvis. So it is very important. Mm-hmm. Okay. So like I said, the pelvic floor, it's the muscles that sit at the bottom, holds everything up, also stabilizes your pelvis when you're moving. So when you're walking, when you're standing, when you're sitting, when you're running, anything that you're doing, your pelvic floor is activating to help stabilize pelvic movement. I'm going to just show you my pelvic model for a minute. Again, don't get caught up in the anatomy and stuff. It's just to kind of give you a visual because I'm a very visual learner. So if you're looking at the pelvis, this is the front of the pelvis. That's the bone that you can feel when you touch just below your belly button. Okay, that's the front of the pelvis. On the back, you have your spine, you have your sacrum. So that's the flat part that you feel like if you try to touch your bottom in between your cheeks, this is the flat part that you feel. And then you have your hip bones on the side. Okay. Now, where my little fingers are inside the model, that's where your leg bones or your femurs would be. There we go. So right now my arms are my legs. Okay. The pelvic floor is this set of muscles right under here. Okay. You follow it?
Yep.
Okay. Mm-hmm. And so this is a female model. This is a model of a person born with a vagina. So guys, don't get scared and don't run away because there's important information for you also. And so this is the pelvic floor. This is what it looks like from the exterior. Okay, it's made up of 3 layers of muscles. So the outer layer is the one that we're most familiar with, because if you don't want to pee, you can kind of squeeze and prevent urination from happening. If you don't want to pass gas, if you don't want to have a bowel movement, you can kind of squeeze and hold things in. And also for females, if you're not interested in having anything enter into your vagina, you can also kind of squeeze and resist entry in a way. So pelvic floor dysfunction happens now when these muscles are not able to fully do their job. So they can't prevent the leakage of urine, or they can't prevent the leakage of stool, or there might be some dysfunction with the vagina, or also your sexual organs. So your uterus, you might have problems with supporting your uterus because these muscles are weak.
Very well said. Very well said, Nadia. Thank you for those explanations. Now, you talk about injury as one of the reasons that creates a problem with the pelvic floor. Can you tell us a little bit more about that? You talk about childbirth and what are the other things that may potentially cause some problems with that area of our body.
Okay. And again, so this is not just about women. So I'll start with that because that is like the major clientele. So for a lot of women, childbirth is a very challenging and traumatic experience. It's like your body is going through a marathon in the time that you're going through labor, and you're pushing this baby out. Okay. So sometimes the muscles down there, well, I said down there.
That's what we call it.
So sometimes the muscles, they get damaged, in having the child pass through the pelvic floor muscles, because that's what it has to do. It has to come through the muscles of the pelvic floor in order to be born. So that in itself, that causes some direct trauma. So a lot of times women after childbirth, they may, or even sometimes during pregnancy, they may have issues with leakage, incontinence, right? So they're not able to hold their urine in. In pregnancy, it usually happens because as your abdomen grows, you have a baby inside of your body. And like I said, the pelvic floor is that bottom where everything sits on top of. And so as the child is growing and you're getting a larger abdomen and your uterus is growing, you're putting pressure on the pelvic floor. And if it's not strong enough to support that weight, sometimes you might leak. Okay. Giving birth, you may have tears. Sometimes the force of the contractions causes tears in the pelvic floor. Or even just the amount of force causes excessive stretching. And so afterwards, the muscles take a while before they can really get back to their normal level of function. And sometimes you need intervention to help with that. Okay, so that's with the birthing. The other thing that people may not realize is that we also traumatize our pelvic floor with poor toileting habits. So this is a big one I want people to know about. So a lot of times people have issues with constipation. And so when you're constipated, you tend to force and you try to push. And so all that pushing and forcing also stretches and weakens the pelvic floor muscles. Okay. Also, sometimes when we go to the bathroom to urinate, we tend to push and force. So like we're in a rush. Toileting should actually be a very relaxed experience. And for many people, it's not. And so in poor habits, we tend to strain the pelvic floor. The other thing that people are not aware of, many of us, which is the majority of the Western world, we have poor toileting posture. We're sitting wrong on the toilet.
How we know? How should we sit on the toilet, Nadia? Ooh, we're learning so much this evening.
And that's what I'm telling you. It's like, this is one of the big ones. And so I want all of you guys to try this the next time you go to the bathroom. When you see a toddler before they're potty trained, what do you usually see them doing when they want to have a bowel movement?
Squat.
They squat, right? So squatting really is the ideal posture when you're trying to relieve yourself. But now we have these nice fancy toilets, and we sit and
sit tall. We call it our throne.
Yes. So we're sitting there and we're not realizing that we're not putting our body in an ideal position in order to evacuate. So there's this big thing now that, well, I mean, again, if you're not really versed with the situation, the squatty potty.
Yes.
You've heard of that?
Yes, and Agnes, you're right. I'm checking the comments on Facebook. Agnes, you're right. The foot tool, like a stool under your feet. Yes, I've heard of it.
Right. Yeah. So because we have these high toilets now, we now have we need to put something down below the toilet so that our knees are sitting above our hips so that we tilt our pelvis in the right position to allow it to relax so that we can, defecate properly. Okay. So again, until it's a problem, it's not a problem. So most of us get away with it. But I want you guys to try it tonight, okay? Or try it the next time you go to the bathroom and see if it seems easier. Because that's one of the things that really, you do it and your pelvic floor relaxes and everything just does what it needs to do.
Right.
Okay? So that's one of the things. The other thing, so I want to talk to my men now, or not just men, but people who are involved with a lot of lifting and heavy lifting things. A lot of times body mechanics can also interfere with the pelvis. Because like I said, the pelvic floor stabilizes your pelvis. And if you're somebody, your job that requires a lot of work, or if you're a person who likes to work out a lot and you're doing like heavy weights, if your body mechanics are not good, sometimes you can put excessive strain on the pelvic floor, on your back, on your hips, on your abdomen. So all of these are your core muscles. The other thing with heavy lifting, I mentioned that the top of the core is your diaphragm. So a lot of times we have poor breathing patterns as well. Okay. And so if we're not breathing correctly, we can build up a lot of tension and force in that core. And that can also put strain on our pelvic floor. So I'm telling you, Simone, there's a lot.
Yes, there is a lot, Nadia. And I'm sitting here thinking, why is this the first time we're hearing all this information? I'm so happy you reached out to me, and I'm so happy we have this platform to share this information. But let's talk about, before we get to therapy, are there any preventative measures, any way we can maintain the health of our pelvic floor?
Yes, there is. There is. So like I was talking about, so proper mechanics when you're going to the bathroom, okay? Proper body mechanics when you're moving. So if you are, like I said, if you're an exercise person or if you're a heavy lifting person, and like I said, even just in general, I notice people, they bend over and they pick something up, they never bend their knees, right? So a lot of times you're using your back and you're straining your back. When you're bending over, you're really supposed to bend your knees and
bend your knees,
your legs, right? You always hear that, lift with your legs, not with your back. But people just kind of fling themselves over and pick something up. And so you see that everywhere, poor body mechanics everywhere. And then back pain, that's an epidemic in itself. A lot of people end up having back pain, and it's because of the poor mechanics. Just right now, just learning the fact that you have a pelvic floor and learning about what it does. And also,
and just being mindful of it, because I think we're not mindful. Because, for example, you speak of bending over to pick something up, and you might think, well, I might strain my back if I don't bend my knees. But you never think, oh, I might strain my pelvic floor.
Right.
If I'm not lifting things correctly, if I'm not bending my knees. So it's just about raising awareness. And that is what we're doing this evening. We're raising awareness that this is literally the part of your body that supports everything from, beyond your legs up. So it is so important to be aware of it and to know how to keep it healthy.
Yes.
Yeah,
like I
absolutely.
said, for most of us, it functions well, or if something happens. So that's the other thing. Like if you have a back injury, you don't think of other parts. You have a back injury. But your back injury could potentially stem from, like I said, a weak pelvic floor, weak abdominal muscles, weak hip muscles. So everything, your body doesn't work in single parts. Your body works in concert with each part that's moving, right? There's a synergy that happens in your body.
Right.
So it's important to understand how everything works together. So
absolutely. And now, before we talk about getting to the point where you need therapy, are there some basic tips that we can use just to make sure we're keeping that area in tune? I've heard some exercises, and we're going to be very gentle about the way we explain those exercises. I've heard some exercises that we can use to maintain the health of that area. So I want you to explain in your professional ability those exercises we can use for those particular areas. And I just want everyone to know that I am seeing your comments on Facebook, and I will take them in a little while. So keep the comments coming, keep the questions coming as well.
Well, before we get to the exercises, the other thing I want to add, diet and habits. So toileting habits. So this is a big thing. We need to make sure that we're hydrated. Okay, a lot of people don't drink water. Some people, they drink plenty of water. Other people don't. So it's very important to stay hydrated to have proper urine flow. Also, having good amounts of fiber in your diet so that you have a good stool formation so that it's easy to pass. Like I said, constipation is a big thing that people deal with all the time. And some mechanical changes, like the way that you go to the bathroom, or some diet changes, and also exercise can really help. And when I say exercise, I mean exercise in general, just kind of moving your body can help with that. So now here's the other thing. You were talking about exercises for the pelvic floor. So everybody does Kegels, right?
Yes.
Most people do Kegels wrong.
Help us, Nadia. Please help us.
So I want you guys to try something. Okay? So we know where the pelvic floor is now, right? The muscles between your legs, right? Right in here. So what I want you to do while you're sitting there, I want you to try contracting those muscles.
Right.
Squeeze and hold for 10 seconds if you can. And then relax. Okay. What did you feel? Like in terms of what muscles contracted or what area of your body was involved?
The area that's supposed to contract.
Okay, perfect.
Did anybody else try it? I hope you did. And I'm seeing Randy G. I wonder if that's Randy Glean from MSU. I hope it is. If it is, we have to give him a special shout out because he's the one responsible for all of us being at MSU. Yes. So if that's Randy Glean, and if it's not, then Randy G, welcome to the program. Go ahead, Nadia.
Right. So when I ask people to do that, and so if I have the opportunity of looking at them, I can see they contract their abdominal muscles. I can see them contract their thigh muscles. I might see them squeeze their glutes. So when you contract your pelvic floor, you're not supposed to see anything else move. The muscles, you should be able, when you feel it, it's usually an up and inward motion. So you feel like a little lift. Because again, that's what it does. It lifts everything. But if you're not familiar with connecting to that part of your body, you're going to connect to everything else around. Because you are accustomed, you know how to pull your stomach in, you know how to activate your thighs, you know how to squeeze your glutes. And so your body will go to what it knows. Okay. So one of the most important things is to first just learn how to connect with that area. And it's quite unfortunate that this whole area is so taboo in our culture.
Absolutely.
It does so many important things other than what we automatically think about when we think of down there.
Right.
Yeah, there's so many more important things. And my goal really is to help people improve the quality of life. And also, like I said, it's part of your body. Like somebody talked about the chakra. If you're into Eastern medicine, the root chakra, that is your source of power. You know, that's your power center. And most of us, we are taught to be ashamed of down there.
Yes, and not talk about it at all.
Talk about it, right? And so it does play into our mental health as well, because, like I said, I'm amazed at the response that I got when I was telling people that we were going to do this, because it's needed. But if we didn't decide to do this, everybody would be like, shh, 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 shh. Yeah. Nobody.
And suffer in silence.
And suffer in silence, right? So it is a very amazing part of you that when you can connect with it and separate it from the sexual aspect of it, it's so important to your overall health and well-being.
Absolutely. Very well said. And now, when should we seek therapy, Nadia? How do we know that we have a problem and we need to seek therapy? What symptoms should we be looking out for that says it's time to get some help with this issue?
Okay. All right. So, like I said, mostly you would find that people have issues with incontinence, which is leak in urine. And so there are different types of incontinence. And I want to also point out stress has a significant factor on one aspect of incontinence that I'd like to talk about. But the big one is called, well, funny enough, it's called stress-induced incontinence, but it's not a mental stress, it's a physical stress. So that's the incontinence when if you sneeze or laugh or jump or cough, you might leak a little bit of urine. Okay. So when your body is going through a forceful contraction, your pelvic floor is not able to maintain its closure to keep everything in. So that's called stress-induced incontinence. So a lot of times you hear people say, I laugh so much I almost pee myself. Right? So that's what I'm saying. It's like we hear this in our community and we don't realize what it is.
Mm-hmm.
So if you do have issues with sneezing, coughing, jumping, running, anything that puts stress on your body, it's a good time to start talking to a pelvic floor therapist to kind of help you with getting those muscles activated so that you can control that. Because the problem is it might start off little, it might not be major, but with time, if you're not connected to this part of your body, you're not strengthening it and you're not conditioning it, as you get older, it can become worse. Okay, so that's stress-induced incontinence. The other one, what I found right now with COVID, a lot of people are having what's called urgency and frequency. Okay, so that's when you feel like you have to keep going to the bathroom all the time. Like every 10 minutes, every 15 minutes, every hour or so, you feel like you have to go to the bathroom. And when you get there, it's not like you're really doing anything. Mm-hmm. But your nervous system is so overreactive that one of the places your stress shows up is in your bathroom habits. Okay. The other thing is urgency. Is like sometimes you're doing fine, and then all of a sudden you get this sudden urge that you have to go to the bathroom right now. And if you don't go right now, you might pee on yourself. So right now you have a lot of people who are dealing with that. And it's because of the increased stress levels with COVID. We have financial insecurities, we have health insecurities, and these things are weighing maybe not on the front of our mind or sometimes in the back of our mind. And one of the ways our body deals with it is in doing things like urgency. The other thing is, again, bad habits with what we call the just in case peeing. And mostly women have this problem. You leave in the house, you say, okay, let me go to the bathroom just in case.
Yes. Yep, we all do.
Let me go just in case, right? Mm-hmm. And so you're starting to empty your bladder before it really needs to be empty, before it's full. And then when there's certain stresses in your life, your body just starts doing it on its own, right? So while you were doing it consciously, your body takes it on as a habit and starts doing it subconsciously.
Interesting.
Yes.
Mm-hmm. So I also want us to look at pre-COVID, what therapy entailed, as well as how you've had to pivot, because this is certainly physical therapy is a very hands-on approach. So I want us to talk about pre-COVID, what therapy entailed, and now because of COVID, how you've had to pivot your business. But before we do so, let's continue to acknowledge everyone on the Facebook Live. And thank you, everyone, for sharing the live. I can see quite a few people, they're tagging folks to come on over and join the conversation. So thank you for doing so. We have Agnes, who says, good topic tonight. Eileen, who says, can't jump because issues too. Good. Let's see. We have Ariane, who says, Caribbean women do a lot of heavy lifting, carrying them pick-me's. Okay, if anyone who doesn't understand, she means carrying children. Whilst being pregnant with one, also runners and other athletes need to practice strengthening their pelvic floor. So thank you so much for saying so. Eileen, should you hold your breath when exerting?
No. So let me talk about that. Mm-hmm. So that's what we're talking about. Pressure. I probably didn't say it, but so let me give a little explanation. So when I said your core is this box, right? Starts from your rib cage all the way down to your pelvis. Pressure is really what you use to stabilize yourself. So when you're contracting these muscles, you're using pressure. The only bony structure that you have in your core is your spine, and that is a very small part of the whole thing. And so what you're doing is you're contracting these muscles to really get a solid foundation for the rest of your body to move. So when you activate your core, you're stabilizing your trunk so that you can move your arms, you can move your legs, you can do whatever. When you hold your breath, when you hold your breath and you're doing a movement, or let's say you're lifting something, you're adding tension into the system by that extra weight that you're putting on, plus you've closed everything in that core where you've built up a lot of tension. So usually when we're helping people, like we're doing something strenuous, we say you have to breathe out when you're doing something strenuous. a lot of times, like for example, when you're playing somebody playing tennis on TV, you hear them making oh, oh.
Yes, yes. Sometimes it's a little bit much if you ask me.
But what they're doing is they're generating force, and by doing that audible sound,
Exhaling.
they're releasing some of the pressure. So yeah, so if you're doing lifting or moving or even anything strenuous, you really should be coordinating your breath with what you're doing. So you really should be breathing out when you're doing something strenuous.
Yeah, absolutely. Thanks for that. Agnes says, when I drink a lot of water, my body flows much better.
Yes, Agnes.
Absolutely. Let's see who else we have. Louisa Jean-Pierre makes me hold my breath when I do pelvic floor exercises. I'm wondering if she's asking if she should hold her breath when she's doing pelvic floor exercises.
No.
Okay.
No. Like I said, whenever you're doing something strenuous, and it's kind of hard to explain that to people just like on a general talk like this. That's why I want people to really reach out. If you have questions, reach out.
Yes.
I have like a free 15-minute consultation set up.
Mhm.
So if you have specific questions, let's talk about it.
Yes, and we're going to do a walkthrough through your website in a minute. So I'm happy that you sent me that link. Arian says for pre-pregnancy, postpartum, and for women entering their 60s, it's highly recommended in many European to
Yes.
practice Kegels. I promote this product called Pearl Lift. DM me for more information. So are you familiar with what she's referring to?
I'm not, there are so many things out there. I'm not familiar with
Okay.
that one, but I will definitely look into it. And so
Mhm.
with that, there's a concern that if you don't know, if you're not connecting with the right group of muscles, you may be doing it inaccurately.
Absolutely.
That's what I want people to realize, that you have to first identify this area that you have very little familiarity with to make sure that you're doing the exercises correctly.
Yeah.
A lot of times people do Kegels incorrectly because they don't know.
Mhm. Now, this is such an intimate topic, Nadia, and thank you again for being here. I'm just curious about the physical therapy, the hands-on approach. So, but
Right.
before we talk about this, I just want to remind everyone that thank you for being here, and we're speaking to Nadia Mills. She's a physical therapist, and she's telling us about the importance of our pelvic floor, what it is, how we can keep it healthy, and what we should do in terms of physical therapy in case we have some issues down there. Yeah, so it's such an intimate part of your body. What does therapy
Well, so like,
include
okay, so
pre-COVID?
pre-COVID, right? So pre-COVID, everybody was coming into the clinic. So we start off with a postural or a overall structural evaluation. Because like I said, your body works in concert. There's not just one thing that's happening. So a lot of times when people come in, we look at their posture. Because posture, again, oh my gosh, posture is such an essential thing for overall health. And a lot of times in correcting posture, the rest of your body works well. So we look at a postural assessment, we look head to feet, because sometimes you're having a problem at your pelvis, but really the problem's starting at your feet. Okay. Sometimes I've even had patients who are having problems with their neck. They're having neck pain and the problem's starting at the pelvis. So it's not, you don't just look at the pelvis, you have to look overall. We do an assessment in terms of daily life, lifestyle, fitness level, diet, and we do a lot of talking. The first visit is a lot of talking. I usually call it the first date.
Yeah, because you get so intimate, it has to be a dating process. Absolutely.
Right. So on that first date, I pull out my model, I explain everything, I talk about the function of the pelvic floor, and I look at the, like I said, the general structure of the person. And then I explain, if necessary, if we have to do manual work on the pelvic floor, I explain what that is. And so after the first date, they get the choice whether they want to come back for a second date.
Yeah, yeah, very important.
Oh, that's not for me. Okay.
Boy.
So in order, like say, for example, you have to access the pelvic floor directly. The pelvic floor is made up of 3 layers of muscle. Okay. The exterior layer, like I talked about, is the sphincter layer where we can contract and close. You can access those externally. The other 2 layers you have to access internally.
What does that involve?
What does that involve?
I'm afraid to ask.
That involves my very special tool. Okay, so my finger. And this is where this was like,
Right, right.
But if you
But it's
need it,
important. It's
it's important.
important.
Right. And like I said, it's not always the case that we need to do manual releases. So what we do is we insert the finger, whether vaginally or rectally, depending on where the problem is. Because you could have a problem to the front, you could have a problem to the back. So depending on where the problem is, we can assess the muscles from the inside to see whether or not the muscles are activating. Because a lot of times those muscles are just not working. You ask somebody to contract, they can't contract them because they're either too weak or too tight. And then let me explain that too, because a lot of times when you say something about, oh, that is tight in that area, people think, oh, that's a good thing.
Yeah, that's what I was thinking.
No, when I say tight, it's not a good thing. So it
Mm.
means that the muscle is constantly on tension, and so it seldom relaxes. Okay, for a muscle to function properly, it has to have a contraction and relaxation phase. Otherwise, your muscle becomes very weak, very rigid, and also starts to atrophy because you strengthen by movement, right? Motion is what really strengthens you. So if we have to do manual work, like I said, we access whether vaginally or rectally to try and target the specific muscles that are not working. So sometimes when we get there, we do find tightness, and it's not always the pelvic floor muscles themselves, because they're also hip muscles that are resident within the pelvic bowl. So sometimes you find out it's your hip that's really causing the problem. Okay, so there's certain muscles that the only way to get to them are an internal exam. If that's necessary, okay, fine, we do that. But other than that, a lot of the treatment involves behavioral change, diet change, and general stretches. So like we might do some hip stretching, we might do some back stretching, because a lot of us have really tight back muscles. We might do, we do some core strengthening. So we really have to strengthen up that box that I talked about, because that's what our body depends on for its stability when it's moving.
Mm-hmm. And also, what is the duration of therapy? So how long are the therapy sessions? And on average, how many times do you typically see a client?
Well, again, so pre-COVID, when people were coming into the clinic, we
Mm-hmm.
generally see them once a week.
Okay.
Because, like I said, it's not so much the need for manual, it's really the need for change,
Yeah.
behavior change.
Right.
Like I said, the first time they come in, I explain everything. I usually try to hit on the importance of, like I said, hydration,
Mm-hmm.
fiber. There are also foods that irritate your bladder and your bowels. Okay, so we kind of hit on that. And depending on what the problem is, I can give people a chat and say, okay, these are the certain foods that sometimes cause irritation. As you go through the next week, pay attention. If you're eating foods and
And tell us some of those foods if you don't mind.
All right. So number one on the list, favored by many, is coffee.
I thought so. I thought so.
So
Mm-hmm.
coffee, it's a diuretic, which means it causes you to urinate, but it has a lot of acid in it. So mostly acidic foods. So the acid is what really irritates the bladder. And then when you have people who don't like to drink water, they will say, oh, I drink coffee, I drink juice, I drink soda, I drink whatever. I said, do you drink any water? No. Anytime you put a fluid in your body that's not pure water, you're giving your body work to do. Okay. So even let's say, for example, you drink a glass of water with lemon in it. Lemon is acidic, right? Your body has to first process it and separate that acid out of the water before it could start using the water function. So I always tell people, no matter what you drink, you have to drink water.
Right.
Right? You drink water, your body absorbs it. It doesn't have to do anything to it.
Absolutely.
Okay. So coffee is number one. So
well, before you go on, Nadia, they're killing me on the Facebook Live with the comments about the coffee. My sister-in-law Sabria said, "Wow." Then Eileen said, "No." Then Nicole Georges said, "No, sir, not giving up coffee."
Well, so here's what I tell people. I am not one of those people.
Thank you, guys.
You can't do this. You can't do this. You can't do this. What I tell people, I say, if you have to drink coffee, before you drink the coffee, drink a little glass of water. So I try, like I said, behavioral modification.
Yes.
So I don't tell anybody you have to give up X or Y.
Right.
I said, okay, before you drink your coffee, drink a little glass of water. Before you drink your soda, drink a little glass of water. So it's to add in that habit. So
And
coffee,
what does that do? Does it dilute the other drink that you're drinking? What does the water do before the other drinks?
well, like I said before, anything that you put into your body that's not pure water, your body
Mhm.
has to work on it before it can use the water.
Okay, so then you'll drink less of the coffee and less of the juice. Is that what
Yes,
you're saying? Okay, got you, got
that's
you, got
exactly
you.
that's the trick. Don't tell them.
Okay,
And
okay.
that's why I said drink it before, because if you drink your coffee and you're full, you're not going to want to drink the water.
Right,
So
right.
drink it before. So
Yeah, sorry to interrupt. The other foods you were talking about. My apologies.
oh no, that's fine. So coffee is the big culprit. Tea also. So we have our bush tea back in the Caribbean. I'm not talking
Yes.
about that kind of tea. I'm talking about green tea. And again, yes, it's good for you. Green tea, black tea, because that also has a lot of acids in it. Okay. Uh, soda. Soda is pure carbonic acid. Carbonic acid and sugar and water and flavor. So these are the things, like I said, I don't tell people you can't drink them, but if you are going to drink them, please drink some water before you do. And then once you kind of point that out to people and they make the connection, sometimes they're willing. Sometimes they're willing to make the change.
Mhm. Now, any medication involved in the therapy, or it's strictly behavioral?
So physical therapy, we don't do anything in terms of medications.
Okay.
I'm in Pennsylvania. We do have what's called direct access, where you can get a script. So we have to, get a script. Well, actually, no. So direct access, you can come straight to a therapist for the first 30 days for therapy. But if you want to continue beyond that, you need to have a doctor's involvement. So a lot of times we work with physicians in terms of medication management, and in case of anything that might be useful in the medical terms, because we don't prescribe medicines.
Right.
That's why I said physical therapy was more fit for me, because it's more of diet, nutrition, movement. That's what I felt was health.
Mhm.
Okay. So
Mhm.
anything that involves medication, we work in conjunction with your medical provider in terms of that.
Yeah, so now the big question with all that physical therapy, how did you manage during COVID-19,
Well,
where you could see no one?
COVID is what actually caused a pyramidal shift. So,
Yes.
like I said, I have always kind of been the manual hands-on. I feel like I have to touch somebody to help them. But with COVID, people stopped coming to therapy.
Yeah.
For roughly for a year, our clinics were pretty much empty.
Mhm.
And so the good thing, the company that I've been working for, they're really good that they kept everybody on. They kept
Good.
other things. So it's a hospital system. So when the outpatient wasn't working, when people weren't coming in anymore, they allowed us to do other things throughout the system, and they
Mhm.
continued to pay us. Right. So that's a blessing. But we had to pivot to the telemed
Mhm.
telemed option.
And how does physical therapy work through telemedicine? That's what
Exactly.
everybody wants to know.
So that was my thing. Is like, how in the world am I going to teach people things, what they need to do? How am I going to assess them without touching them?
Right.
So that was a dilemma for me. Okay. But a lot of times, hard situations push us to a level that we didn't know we could go to. And so with doing the telemed, I have come to realize there's a lot of stuff that you could do without being present with a person, without touching a person. And it really works on your ability to communicate with people,
Mhm.
right? So we've been doing the telemed, and we're back to being in clinic now. But in that transition, I realized, wow, you can do pelvic floor therapy via Zoom, via Facebook or whatever. Because, like I said, a lot of it is behavioral, a lot of it is exercises that people are somewhat familiar with, and a lot of it is self-reflection. So getting people to connect to that area of their body. And so there's a lot that can be done just in this kind of setup. Just me looking at you. So I can do your assessment. I can look at your posture. I can look at how you walk. I can look at how you move. And I can demonstrate for you what you need to do. I can look at you and correct you as you're doing it. And so surprisingly, I'm like, this model really works.
Interesting.
Yeah.
And then you also provide videos and other
Yeah.
resources. Tell us about that.
Yeah. So I've started my website or my business, DT.
Yes, I'm gonna pull it up right now as you're speaking so everyone can take a look. So continue talking.
Right. So DTPT Wellness,
Tell
because
us what that means.
oh, down there physical therapy and wellness,
Love the name.
right? And
Uh-huh.
with that model, like I said, we can do online based pelvic floor therapy. And the other thing that I do, so you have up there the services. So we can do online based physical therapy, online based lymphedema management, and online based injury prevention and progression. So that's the other thing that
Mhm.
I'm passionate about. I am not an athlete by any means, and I always want to give people the opportunity to better themselves. And so there are a lot of people who stay away from wellness or fitness because they're like, oh, well, that's too much for me. I can't handle that. Or I have an injury or I have a problem. And so part of what I also provide is services for people who are not your typical person who could just go into a gym and start a program,
Mhm.
right? So people who
People who
need a little extra guidance, things to do, things to avoid. I've also been working with people who have been in the gym and who are at a high level, but they're having a difficult time passing a certain point because they have a history of an old injury of some sort.
Mhm.
And they can't get to the next level because this injury, they keep re-injuring themselves. And so I kind of help them to focus in on the deficits that they're having so that they can get that part of their body up to the level where they can continue to advance their program.
Yes, absolutely. So give us a little tour of the website. So you tell me where to go. I want to scroll down so we can just see the goal of your company to help increase awareness of pelvic floor dysfunction and lymphedema and to educate our clients on treatment and management of the conditions. A very well done website, Nadia, I have to say. So here are some of our services and just kind of tell us. So I think you kind of talked about just about all of them at this point.
Well, so the last one, so the other thing that I want to do, like you said, before I approached you, this wasn't something in your radar or something you'd really heard about.
Mhm.
And that's not unusual for healthcare providers as well. There are doctors there. This is the thing that really concerns me. Because at the point that some people come to me, they have had problems for years and they have been to multiple doctors. And finally, they got to one doctor and said, okay, well, maybe you should try pelvic floor therapy. So it is also my goal to educate the medical community about
Mhm.
these conditions and that there are treatments that help with these conditions. So that
Mhm.
last tab there says training and education. So I'm training, like I said, health providers about these things and to make them aware of what treatments are there and available.
Right, and you have an entire team with you, so that is wonderful to see that these are the folks that who work with you as well. So this is great. Anything else you would like to highlight from the website?
Well,
Maybe
if you see right there, I don't have my glasses, but if you see
the
right there,
testimonials, maybe?
oh, a testimonial. Okay, well, yeah,
Yeah.
you can read that testimonial. That was one
Of
of my
Nadia
patients.
Mills is a miracle worker. I came to her with urinary incontinence, constipation, and age-related sexual issues. I actually saw results after the first session. Nadia is so kind, caring, and knowledgeable, and every week the results get even better than my wildest expectations. So everyone can go on the website and read more about what everybody else is saying about Nadia. And keep in mind that she's only getting started, so there might only be just one review, but I think you can
Right.
already hear from everybody else who's joining us via Facebook Live how highly they approve of her services. Anything else on the website, Nadia?
Well, like I said, it's just right now a basic website that's
Right.
giving this general information. The key is I really want people to contact me. I want you to
Yes.
ask me the questions that you didn't know you could ask somebody about,
Mhm.
So there is, I was saying, there's an option on there that says click here for a 15-minute consultation. So
Mhm.
I would like everybody to take the opportunity to set up a little meeting with me. It's private
Yeah.
and just ask me anything.
And what I'm going to do, I will post the website in the comments section so everyone can just click on the website and they will be able to get in touch with you. And I want to thank you for sharing all this wonderful information. Let's take a couple of the Facebook Lives before we wind down the program this evening. And again, I want to thank you for sharing on a topic that most of us did not know
Right.
was an issue and could not put a name to.
But like I said, we know it's there, but we didn't know there was anything that could be done about it.
Yes,
We live with it.
absolutely.
Yeah.
Yes, absolutely. So let's see. Dunia, something, I had coffee chiller today. I'm not sure what she's saying here. I think she's talking about when you referred to not having coffee. She said she had coffee today.
Okay.
Louisa, what about grated ginger tea?
Well, actually, that's pretty good for you. The ginger is an anti-inflammatory, so that's actually pretty good. So when, like I said, we have our bush tea in the Caribbean. So I'm not talking about bush tea. I'm talking about green tea, black tea, the tea bag stuff. That's not herbal tea. So, and what I can do, I can put up or I can send to you the list of foods that, and you know what? Contact me. If you're interested, talk to me. So that's the other thing. I don't want people to just go, oh, okay, well, I could just, figure it out myself. Please don't figure it out yourself. There's somebody.
That's why we have professionals like you.
Right. There's somebody you can talk to.
Yes.
You can't embarrass me. You can't tell me anything that I have not heard before.
Yeah. After 15 years, you've heard it all.
If you tell me something and I never heard it before, I say, oh, really? Tell me more. This, I'm telling you, this is perfect for me. There's nothing embarrassing. And for people, this is awkward. For me, this is every day. Okay. Yes. So I try to make what's awkward for you a more comfortable situation. Because one of the things also people think is, oh, it's only me. And, oh, I've been to these doctors before. And they say, well, just live with it. And there's nothing that could be done. So how could you do something? Right. Okay. Set up a conversation. Let's have a talk. And we'll see what goes from there.
Yes, let's grab a couple more comments before we head up, Nadia. Eileen says the entire discussion has been highly entertaining. Well, I hope it was informative as well. I've laughed so much, like us girls just sitting around having coffee and chatting, maybe tea, not coffee, and chatting. Thanks, Nadia and Simone. I needed this in many different ways. Thank you, Eileen. That was very nice of you. Johnson Thomas, I have right now 3 cases of water. I drink 3 bottles a day. Good for you. And everyone else who shared the live Tyrell informative session. Nadia is very knowledgeable. I absolutely agree.
I do want to add one thing. So like I said, we tend to focus on women, but guys, I know you have problems too. It might not be the incontinence issues, but it might be pain. Okay, that's another big issue. Pain in your genitals, pain in your buttocks, pain anywhere in that area I talked about, from ribs down. If you have pain, call me.
Yes, Eileen, we well done, love. You put people at ease. I can certainly see why you think so, Eileen. Hadia, I'm sorry, Byron. Very informative, loved the energy. So thank you everyone for being here. Now, Nadia, are there a couple of things you wanted to show us on the table before we head out?
Oh, well, okay. So the other thing, so again, it is physical therapy. So at some point, depending on what your goals are, you have weights. You have pelvic floor weights that you can use. So I just want to kind of show a couple of examples. So there are weights that we use for strengthening. We are talking about muscles. So just like how you do your bicep curls, you can do pelvic floor curls, let's say. If one of the issues some people have also, they have issues with penetration. And this is a big one. I'm sorry that we're taking extra time, but
no, absolutely. Take your time. We have all day.
Okay, so it's not just issues with sexual penetration. So issues with having a speculum for a gynecological exam. And so this is important because if you cannot assess what's going on inside, you really are at a higher risk of cancer and other dysfunctions that happen. So sometimes we have tools that we can use. So if, for example, your goal is to be able to have a pain-free gynecological exam, we have tools that we can use to help stretch the tissue to allow for a gynecological exam to take place. Also, if you're having painful intercourse, because that is another big thing. And I didn't even realize that until I get into this realm, that some people are not even able to have penetrative intercourse, or they have painful penetrative intercourse. So we have little tools that we use. We also have little games that we use. We try to make it fun. So there are actually pelvic floor games that you can use to strengthen your pelvic floor. So this one is connected to an app that is kind of like a video game that you can play. So it's better than Candy Crush. So
I
you
believe you.
can be entertaining yourself and strengthening your pelvic floor at the same time. Okay.
Yes, yes. Yeah, thank you so much, Nadia, for sharing all your knowledge and information with us. So before we head out, any final thoughts you want to share with us this evening?
Well, I have really appreciated the response that I've received. And like I said, people don't talk about it. So you really don't know what the interest is. And my goal really, I came to you specifically because before I left home, I saw things and I knew
Mhm.
things. And then as I became more knowledgeable, I realized we really need these kind of services in the Caribbean. Because like you said, we sit there and we suffer in silence. And so my goal really is to reach out to, there are other people on here, but this goal is to reach out to my Caribbean brothers and sisters to
Yes.
let you know that there are things that you need to start addressing, and we can't just push it under the carpet and not talk about it.
Yeah, and it's time to bring things to the forefront. For way too long, some stuff has just been taboo, and
Yeah,
we need to talk about it.
yes. And your
Mhm.
life will be so much better for it. So
Mhm.
thank you, Simone, for this program. You know, you reach out, you like you say, you're all over the place. You reach
All
out
over the
to
world.
people. And so let's take this opportunity. Reach out, learn something,
Yes.
improve the quality of your life, because that's the goal.
Yes.
Improve quality of life.
Yes. Now we have your website, but do you want to leave us any additional contact information, maybe an email address where folks can reach you?
Okay, so there is a contact page on the website. So if you want to check out that, you can go to the contact page and reach me there. Or you
Mhm.
can directly email me at info at dtptwellness.com. So it's just info at the website address.
Yes, and thank you everyone for being here. Everyone says, Judith says, very informative, well presented, Nadia. You have taken an important and sensitive area that needed to be addressed. I could not agree more. Sabria, great session. Thanks, ladies. Hyde, I can't pronounce that name. I'll just say Miss Byron. We're here, St. Kitts Massive, and I'm so happy for the St. Kitts Massive. We recently had Psyche Southwell, who's
Yeah,
also from St. Kitts.
yeah.
And earlier on, I saw a message from Beverly Sanford. She remembered you from
Oh,
MSU.
yeah,
So
yes.
she said hi as well. Let's see, Garfield, always meant for greatness.
Uh,
Nice compliment to you. And Eileen finally says, you rock, great job. So thank you again, Nadia. Thank you for sharing your wealth of information. And I encourage everyone to check out your website. I posted the link directly into the comment and share the information. Share
yeah.
the information with as many people as possible so that we can stop keeping these conversations and these subject areas as taboo and we can get the help that we need. So if you enjoyed this conversation, I want to thank you for being here and I want to encourage you to follow Push Past 10 on Facebook or visit my website, pushpast10.com, for more information about what I do. And I certainly enjoy celebrating and promoting us as Caribbean people, promoting our stories, our journeys, our products, our businesses, and our culture. And again, this summer we're having a summer celebration. So remember to follow Push Past 10 for more information. And remember to share this information and share this video so we can keep informing our Caribbean brothers and sisters on very important topics. And I see Simone Dillon. I love your name, Simone, by the way. Says, thanks, Nadia, for educating us. Please have this session again. Great show, Simone. Thank you. And great name. I agree. And let's see. Ariane, great stuff. Ladies, thank you. Going to contact Nadia, please do. Louisa, thanks for discussing the subject. Mama too, thanks, Nadia, for this beautiful education. So once again, Nadia, it was great having you on the program, and I look forward to having you come back as we continue this very important conversation. So you have yourself a wonderful evening.
Thank you. All right. Have a great night. Thank
All
you.
right. Thank you. Bye-bye.